Hello everyone, I am John Mark Noyad together with Adam Michael, Romil Maguate, Jovin De La Torre, and Paul Jansen Largo, and we're going to discuss about the principle of double effect. What is the principle of double effect? A moral and ethical concept that is often used in discussion of ethics and decision making in situations where an action may have both good and bad consequences. It means the principle of double effect is paraan or the way of thinking about sa mga decision natin na gumawa ng mabuti pero may bad consequence or bad effect. For example, imagine you're a doctor and you have a patient in a lot of pain. To help them, you give them strong medicine, but you know it might make them very sleepy. So the principle of double effects here is you want to make good things, which is to give medicine to your patient, but there's a consequence or bad effect, which is the medicine make your patient sleepy. And yun po yung example ng the principle of double effects. That's all. Thank you. Four components of the principle. Number one, the intention behind the act. Number two, the act itself. Number three, foreseen and intended effects. And last, number four, proportionality of good and evil effects.
The second criterion, the intention behind the act, assesses the motive or purpose behind an action. For instance, direct intention involves action aimed at providing pain relief to a terminally ill patient, while indirect intention involves action like administering medication with a potential side effect of pain relief, where pain relief is not the primary goal but a possible outcome. The intention behind the act delves into the reason or motive driving a particular action. In a direct intention scenario, the action is carried out with the explicit goal of providing pain relief to a terminally ill patient. In contrast, in indirect intention situation, an action is taken, such as administering medication, where the primary aim is not pain relief but rather addressing another concern. Yet pain relief might still be a potential secondary outcome.
Good day, sir. I am Jovin De La Torre. Today, I will discuss about the act itself. So, the act itself. The first criterion of the principle of double effect focuses on the nature of the action itself. Examples: intrinsically good act, saving a life through medical treatment. So, imagine, yung doctor is may patient siya, tapos yung patient na yun is in severe pain. Tapos yung only way lang to relieve the pain is to give strong medication. So, yung main goal ng doctor dito is to help the patient feel better by giving them the medicine. So, that's a good action and follows the principle of double effect. So, now let's say, yung doctor is, yung main intention niya is to harm the patient. Tapos, yung side effect ng medicine is pain relief. So, that would not follow the principle of double effect because the main action is bad kasi yung main intention niya is to harm the patient. So, yung principle of double effect says that the action itself should be good or neutral. Hindi dapat yung bad. And the good outcome should outweigh any unintended bad outcomes.
Hello everyone, my name is Romil Maguate and my assigned topic is foreseen and intended effects. Foreseen and intended effects. This criterion addresses the distinction between effects that are foreseen and those that are intended because of an action. Foreseen effects are consequences or outcomes of an actions that are known is occur as a result of that action, but they are not necessarily the primary or desired objects of the action. So these effects can be expected, anticipated, or predicted, and they are generally considered as secondary or unintended outcomes. So while they may be undesirable, they are not the focus of the action itself. So next is intended effects. So on the other hand, intended effects are the primary objectives or goals of an action. They are the outcomes that are the persons or entity performing the action aims to achieve. Also, these effects are not merely foreseen, they are deliberately sought and are usually the reasons for taking the action in the first place. For example, foreseen effect, administering pain relief medication with the foreseen effect of drowsiness. So the foreseen effects, the drowsiness is the side effect or foreseen effect that you know might occur when taking these medications. It's not something you actively desire or intend to happen, but it's a known and expected consequences of using the medication. On the other hand, intended effects, administering a sedative medication with the primary goal of inducing sleep. Intended effects is the main of the objective or purpose in administering the sedative medication is to intentionally induce sleep. In this case, including sleep is the primary goal or the desired outcomes. So in this combined scenario, the intended effect is directly related to your main goal, which is including sleep, while the foreseen effect is the drowsiness that you know might occur as a secondary outcome when using the sedative medication. So yeah, the intended effect aligns with your primary purpose, while the foreseen effect is a related but unintended consequences. That is all.
Hi everyone, this is my topic, proportionality of good and evil effects. This criterion focuses on evaluating whether the intended good outcomes justifies the foreseen negative consequence. Example, administering a high-risk surgery to save a life when no other option are available.